The difference between hypothyroidism and hyperthyroidism. Hypo is a low and hyper is high. When you have a hypothyroidism, we have a low hormone in the body. The reason can be anything. So we have a low thyroid, T, T3, T4, that is a hormone which are directly secreted from the thyroid are low in body. So low thyroid is called hypothyroidism. When you have hyperthyroidism, where you have high thyroid circulating hormone in the body, that is high T3, T4. So both are the conditions where we have hypo and hyper, low and high thyroid hormone. So hypo is low hormone, low thyroid hormone. Hyper is a high thyroid hormone. Both the conditions are different. Thyroid, if you start with hypothyroidism, hypothyroidism you can have because of Hashimoto thyroiditis, because of any post-surgical, any patient undergoes thyroid surgery or radiotherapy for hyperthyroidism, or they have viral thyroiditis, drug-induced, or like lithium and all this thing, amiodarone. There are something called primary hypothyroidism. So there are multiple reasons behind hypothyroidism. So where you have a primary disease affecting the thyroid hormone, you can have secondary hypothyroidism because of hypothalamic pituitary axis, the deficiency in the hormone at a pituitary level or hypothalamic level. That is a secondary hypothyroidism. Then the thyroid get directly affected by the infections or thyroiditis. Thyroiditis is supposed to be the commonest reason for the hypothyroidism that we encounter in your daily life. This is about the hypothyroidism. Then comes the hyperthyroidism. Hyperthyroidism is the condition where we have a high thyroid hormone. So high thyroid hormone can be because of the Graves disease, and can be Graves disease is a condition where there is a directly autoimmune affection of the thyroid gland, where you have a high hormone level in the body. The Graves disease, toxic nodular goiter, you can have thyroiditis, you can have gestational thyroid disease, then you can have because of drugs. So there are some drugs are known to cause hyperthyroidism. So these are the causes for the hyper and hypothyroidism. You have a different type of symptoms in hypothyroidism and hyperthyroidism. Hypothyroidism is a condition where you have a low thyroid in body, so you develop a weakness, non-static body ache, somnolence, you get obesity, weight is increasing, you are getting a lethargy, you don't feel like working. Many fertile age females, they do not get pregnancy, they do not get regular motions, they get constipations, their skin is dry, they get a swelling in the legs, and they get depressed. The depression is one of the commonest presentation of the hypothyroidism, a psychiatric illness. This is about the hypothyroidism, where we have a low thyroid. In hyperthyroidism, we have other spectrum or other extreme of the problems, symptoms like you have irritability, restlessness, tremors, palpitations. Your appetite is very high. In spite of having high appetite, you lose the weight, loss of appetite. The body is warm. You feel fever. Many people present with fever only. They have a high fever, which is not the reason is not found. So it is because of hyperthyroidism. They have high fever, high pulse rate. They have chronic diarrhea. Rather not diarrhea, they will have a frequency of motions. They lose weight. They are warm. They are restless. And sometimes they have ophthalmic symptoms like they have protruded eyeball and all this. That's because of the thyroid induced ophthalmoplegia or ophthalmopathy. So these are the symptoms of hyperthyroidism. Usually, hypothyroidism, yeah, we see the woman, the uh, female, those who are expecting pregnancy, those who are any, see, you can have hypothyroidism, male and female. The hypothyroidism common in female, but hyperthyroidism you can get in both the sexes. But any female patient presenting with infertility, weakness, obesity, depression, any palpable thyroid gland, which is called goiter. So these people should be screened. But nowadays we have made it mandatory for all the female who are undergoing pregnancy to do the thyroid. So many times thyroid people they come to hospital from other reason. They may be asymptomatic also and we find out thyroid. So nowadays it is common test like blood sugar you do with the thyroid of all the patients because they're coming for routine checkup also. And if they are obese and they have high cholesterol, they have previous abortion or BOH, bad obstetric history, we do thyroid in such patients. In hyperthyroidism cases, we have any patient comes with fever of unknown origin, fever with patient with any rhythm disorder, any patients with high blood pressure, patient with loss of appetite, person with loss of weight. In such patient, we usually think they can be hyperthyroid. Hypothyroidism, sometime after giving, like some condition where you have post-viral or autoimmune thyroiditis, we give the treatment for some time, they become normal euthyroid and we may not require the treatment for some time, but later on they may get again a relapse of the hypothyroidism. So you can say it's a controllable disease. In some people, small amount where the thyroid can go in hypothyroidism, but usually you require a lifetime treatment for in hyperthyroidism. Yeah, there is a new treatment, radioactive ablation of the iodine ablation, where you give the radioactive iodine and suppress the gland. So you are cured from the hyperthyroidism. But such people, they can go in a hypothyroidism. And any hyperthyroidism patient who goes for a surgery, you remove the thyroid gland or thyroid secreting mass. So they go from hyper to hypo. So for, they may not require treatment for hyperthyroidism, but they require a treatment for hypothyroidism. So it's like you are cured from the hyperthyroidism, but you may require treatment for hypothyroidism because post-surgical, post-iodine ablation, usually these people lands up in a hypothyroidism. So in a hyperthyroidism also, there is some amount of people, they become asymptomatic euthyroid. But most of them require a treatment for hypothyroidism. If you don't want to go for a surgery, radioactive ablations for hyperthyroidism also, you need to take treatment like that. But then you have to monitor your thyroid hormone level. If hormone level comes normal, then you can stop the treatment, but observe the patients. But there is always chance of the relapse of the disease, like grave disease can be relapse. There is no way to prevent it. You can only diagnose it. You can just identify the problem and take care of it. Like there is nothing like in blood pressure or diabetes. If you have to get the thyroid immediate, there is no reason because of obesity you get thyroid or because of lifestyle you get a thyroid. It is a hormonal disease. So any abnormality with hormones, whatever the reason, whatever the cause, you get it. What you can do is just to check your thyroid regularly. That is the only thing. You cannot prevent it. You have to get it. So the mechanism of getting thyroid or causes of getting thyroid is very different. So you cannot prevent it. You have to just diagnose it and regularly check for it.